Medication I got for you today, morphine sulfate. This medication is classified as a narcotic analgesic. And so these medications are going to do things like decrease your pain perception, decrease anxiety, and produce a little bit of euphoria when given in the proper dosing. It can decrease respiratory effort and respiratory drive, which we want to be mindful of. It causes peripheral vasodilation, which sometimes we're looking for certain situations, and other times it may just cause a drop in blood pressure negatively, and we don't want that. So always being mindful in the dosing and in the speed of your administration. Decreases left ventricular afterload, which is another desired effect sometimes in situations like congestive heart failure. We talk pharmacokinetics, how it gets through your body. And it's going to do a couple things. The number one thing it's going to do, it's going to find those opiate receptor sites in the central nervous system. It's going to attach themselves to it, and it's going to do things like alter pain and any emotional responses to pain, which is what we're looking for when we're using it for pain management situations. It can cause arterial and venous vasodilation. And when you have both sides of the blood vessels operating like that, that's when you see the drop in the blood pressure, sometimes a little faster than others. And your onset is typically shorter than 5 minutes in the IV dose. And if they don't have a tolerance, sometimes can last even up to 4 to 5 hours. Now, we talked in the last video about fentanyl and how much stronger it is per unit. But this has more of a respiratory depression effect if we're not mindful of our administration. When do we use it? We say we use it for things like acute myocardial infarction, heart attacks. We can use it for burn patients. We can use it for isolated injuries that require pain relief. And remember the rule of thumb, you know, we would like to make them pain-free if possible, but we certainly are looking to take the edge off, if not more, you know, and those are for physiological responses, like the body going into a better state for healing and repair. The pulmonary edema, congestive heart failure tract, that's where we want to do things like decrease left ventricular afterload. And so you want to be mindful of your presentations, because what's listed up there, please don't give it to the opposite. You might find yourself into some trouble. Like, don't give left heart failure pain dosing, or not pain dosing, but left heart failure CHF dosing to right heart failure patients, and only right heart failure patients. So again, be mindful. Things you want to be mindful of. Now, this one has a lot or a decent amount of contraindications. And these are going to be things like head injuries. If they have multi-system trauma, it's a relative contraindication. We want to be mindful that they are not bleeding out somewhere, and now we're making the blood vessels bigger. You have COPD with the compromised respiratory effort, and it's for the respiratory effort. We don't want to drop it any further than what it is. A breathing with difficulty breathing patient is better than one that's not breathing. And the hypotension again. Sensitivity to morphine, codeine, Percodan, or really anytime they tell you they have an issue taking any of the opiate-based narcotics. Adverse effects that you're going to be mindful of, respiratory depression and even respiratory arrest. Changes in their mental status to include altered mental status or actual unconsciousness. If they have an increased vagal tone as a result of the medication, then they may show you some bradycardia. Be mindful of that. Your nausea, vomiting is something that's pretty standard and typical with these patients, and so oftentimes this is given with a dosing of Zofran or some other antiemetic medication. It may cause bronchospasm, so just be mindful of the already difficulty breathing patient. And it tends to make people itch, and they often itch in the nose, and sometimes that's a tell when somebody's trying to tell you they're not high and their eyes are drowsing and they're nodding off on you. That might be your sign. But again, these medications are scheduled narcotics. So with anything that we do that is associated with the scheduled medication, You want to make sure your appropriate documentation is completed. You've had the waste witnessed by somebody of equal or greater status as you at your receiving facility, and do good things. Remember the ethos. Above all, do no harm. You guys be good. Take care.